across America. Great to have you with us. Joining us now is Andy Mangione, and he is one of the chief executives at AMAC, and AMAC, as you know, the alternative to the very liberal group on the other end. AMAC, great organization. I'm a member. Now I turned over 60, I get to be a member. My mom's a member of it. She's 91. They do a great job, and Andy's with us now. Andy, great to have you, man.
John, thank you for having us, and thank you for being a member of AMAC.
I love AMAC. I mean, you guys do such a good job because, look, the organization that you compete with, it's a total scam because they make, you know how much money they make on the supplemental insurance, and then they lobby so that Medicaid can't pay for everything, so you have to have the supplemental insurance. Do you know how many billions of dollars they make on that?
Lots and lots of billions.
I know, right? So AMAC is the alternative to that. I'm a very proud member of it. Before we get to your specific issue, tell us a little bit about your organization, Andy, and how it's grown.
I'd be happy to, John. AMAC was born almost 12 years ago, actually going on 13 years ago. Our business model is identical to AARP's in that we are a member benefits organization, but here's the big difference, John. We tell you up front, we are a right-of-center organization that supports faith, family, and freedom. And we represent those values in Washington. We've got a full-time presence in Washington, D.C., representing our members on behalf of their values. We are small government. We are low taxes. We are strong military. We are pro-Second Amendment. We are pro-life. We have over 2 million dues-paying members in all 50 states, and we're adding members at the current clip, John, of about 5,000 per week. And more importantly, between 4,000 and 6,000 AMAC members are renewing their memberships each week. So people, once they join, they stick around. We're experiencing a surge in membership. It's fantastic, and it's due in no small part to being on great shows like yours.
Well, thank you, and I really appreciate that. We're with Andy Mangione. Andy, am I saying your last name right?
Yes, sir. Thank you.
Andy Mangione, Senior Vice President for AMAC Action. One of the things I wanted to talk about today is we pay different amounts for different procedures. So like imagine paying thousands more for like a hip replacement or hip surgery at one hospital than the other hospital 2 miles away, simply because hospitals aren't willing to provide patients the cost of that surgery or any other service beforehand. So you go in and you never really know what the price is, right? And whether it's in network, out of network, I mean, transparency is the big issue. And even the president has said that. Give us transparency of pricing. And he said invariably prices come down because now everybody can publish what the prices are. And AMAC has been backing the Department of Justice motion for a summary judgment in one of the cases coming up. Can you elaborate on that?
I'd be happy to, John. President Trump issued an executive order that compels hospitals to disclose the prices they negotiate with insurance companies for medical services. At the heart of this order, John, is the president's desire, as you mentioned before, for price transparency. He wants to empower patients with information, and in this case, prices for medical services, in an easy-to-understand format to enable the healthcare consumer to shop for healthcare much the same way they do for everything else they purchase. Well, the hospital lobby, that's represented by the American Hospital Association, prefers to keep these negotiations secret and sued the Health and Human Services Department, saying that they overstep their authority and what they want to do, John, is block the president's transparency and pricing order. So what AMAC did, the Association of Mature American Citizens joined with other patient advocate groups to file an amicus brief in support of price transparency. And the argument here is that many Americans have high deductible plans, which makes the negotiated prices between hospitals and insurance companies part of their out-of-pocket costs. Now, John, the Hospital Association is arguing that disclosing the prices for medical services basically violates First Amendment rights. But in reality, these prices really aren't secret. We just see them. Patients just see these prices after the fact, and when it's too late to choose more cost-effective care. So it gets very interesting here. There's a Harvard-Harris poll that shows that 88% of Americans, both Democrat and Republican, support hospitals and insurance companies showing their prices. So if we're successful here with this brief and the court grants the motion for summary judgment, the American Hospital Association's case would be dismissed, and the price transparency rule will stand. And we should have a decision in the coming weeks.
Really? What do you expect to have happen? Because normally these haven't gone our way. I mean, the problem is the medical, as you know, the hospital lobby, the medical lobby is very powerful. They spend, hundreds of millions of dollars on this stuff. And hospitals don't want their prices to be public. So what do you think the chances are here?
We like our chances. I'll tell you why we like our chances. They're trying to make an argument that it's a First Amendment issue, and it's not, because the prices are already disclosed. Now, John, AMAC is part of a coalition of physician and patient advocates to reform health care. And there's many dynamic people and organizations involved in this. And we are very encouraged, not only on this issue, on this particular case, but on the multifaceted issues to reform health care. We like our chances here.
So you're battling the hospital lobby that's seeking to overturn what the Trump administration did, was to publish the rates. So if I decide to go to hospital A or hospital B, I have no idea. I have no idea what the prices are. I mean, just think about this, right? What other industry, what other service, and hospital is a service, right? Andy, what other service is there? What other service is there where you have a service and have no idea what the cost is?
None. Okay, John, how about trying to buy a car or a home without knowing the price and then getting the price after the fact and realizing, well, I just got ripped off. Okay, all the president wants to do with this order is to give patients, empower them with the pricing before they choose their medical services. And this is, it's not unreasonable here. Okay, so what people are doing, or what he wants people to do, is to be able to have what he calls shoppable medical services. All right, like that hip replacement, or you have to have a knee. People in our demographic, or AMAC's demographic, have knee replacement surgery, and it's not something that has to be done right now. Okay, it's a situation that deteriorates over time. So wouldn't it be nice that you would have the published prices of a knee replacement surgery in 4 or 5 hospitals in your backyard? You could call, you could shop, and then you could make an intelligent decision. That's what all of this is all about. But the hospital lobby wants to keep everything secret, wants to keep these negotiated prices to themselves and keep business as usual. This is a simple price transparency rule. And you mentioned at the beginning of our conversation, John, what this would do. Pricing transparency would foster competition and as a result would have a tremendous impact on lowering the prices of healthcare.
Well, whenever you get transparency and people have to compete with each other, and the rates and prices are published, that always spurs competition. But right now you don't have. That's the only industry where you don't have it. I don't even know what the argument. Like when you say that the hospital lobby filed a challenge to this, like what could possibly be the justification in the challenge so that people can continue to get screwed? Like what could possibly be the rationale behind that? Andy,
you make a good point, and this is why we like our chances. They're trying to make it a First Amendment issue, saying that disclosing these prices violates the hospitals, the parties that would do the hospitals and the insurance companies' First Amendment rights. But in reality, we all get that bill. We all get that bill after the fact, after the procedure, after the services that we have performed. That's when the reality sets in. So they do disclose these prices, but it's after you've had the procedure. So their argument that it's a First Amendment right is kind of thin. That's why we like our chances.
You said you're going to find out within a week. Is that real, Andy?
A few weeks. No, it's going to be the coming weeks. I was plural. I'm sorry, John. But we don't know exactly when. We anticipated, and I wish I had something more specific for you. We anticipate a decision in the coming weeks.
Where does the AARP stand on it? Do you know?
Well, on this particular, they weren't party to this suit, they weren't party to this brief, and I just think, I would imagine you'd have to ask them Okay, but let me qualify that. We find ourselves, we would love to work with AARP. We just find ourselves 180 degrees away from them on specific issues, like the middleman rebates that pharmacy benefit managers receive from drug companies to expose their products to the millions of insured lives that PBMs manage. The president last year wanted to issue a rebate rule to have these PBMs share these rebates with Medicare beneficiaries at the point of purchase. That would lower their out-of-pocket expenses. We thought that was a good idea, and we supported it, but AARP did not. There's the 180-degree difference, and you could probably surmise how they feel about this issue based on their non-support of that rebate rule last year.
Well, the business model for your competitor, AARP, is to find different ways to lobby for legislation they want and then take advantage of that legislation and make money off it. Right? That's what they've been doing. It's the biggest scam out there forever, and that supplemental insurance is one of them because they lobby for favorable rules for that, and then everybody has it. Was it 85% of people that have Medicaid buy supplemental Medicaid insurance? Or Medicare.
Yes, sir. And full disclosure here, John, we sell insurance too. The big difference is we're going to fight on behalf of our members. We're part of this healthcare coalition as a patient advocate. So we're going to advocate on their behalf. We have multiple carriers. We sell Medicare products, and if one of our carriers doesn't like what we're doing in Washington, well, okay, we'll find somebody else to do business with, somebody else who wants access to our 2 million plus members.
Exactly.
All right. And we tell you exactly who we are and what we're doing. We are not conflicted. We are upfront. There's a lot of transparency in what AMAC does, and we're proud of that. We're going to continue to do that. But, we could risk a contract that we have with one of our carriers, and we enjoy our carriers, and we have a relationship with them, but we're always going to do what's in the best interest of our members.
Yeah, you want to do the right thing, and part of the right thing is getting transparency in hospital procedure pricing so people can make an informed decision. Now, it's good to have you back with Andy Mangione, Senior Vice President of AMAC Action, the Association of Mature American Citizens. They have 2 million members. Andy, for our listeners out there that are over 60 and they're not a member of AMAC, well, why should they be a member?
Well, I tell you, we are a clear alternative. They would be joining, particularly your audience, they would be joining a vast amount of like-minded people that believe in the Constitution, that are tired of all of this nonsense going on in Washington with the Democrats' jihad against this president. They would be joining a faithful people that puts faith, family, and freedom as the premise of any mission statement. We have AMAC chapters throughout the country. And what we do with these chapters, John, is get our members together. And they're relieved because the way they're being portrayed in the mainstream media discourages people. And we want to let people know, people can join AMAC knowing that we are in the majority. The way people that believe in the same values that we do, they constitute the vast majority of people in this country. Although it's being portrayed the opposite way, so they'd be joining a group of like-minded people. They'd be receiving our magazine every other month. That's just not only full of helpful tips on healthy living, but just the content. We received so many compliments on the interviews that we did. I just had an opportunity to interview Senator Rick Scott of Florida for our late spring edition. I was able to interview Mike Braun of Indiana. These guys are they're former business people, and they bring the right attitude to Washington, a can-do type of attitude. And that's really, AMAC has a can-do attitude. We believe that if people join AMAC, they realize. I've run into people that say, my gosh, I had to join the other organization because that's where I got my Medicare from. Well, we sell that too. Okay, we'll be happy to take care of those needs. And, we own our own call centers. They're located in New Mexico, Florida, and New York. You'll be speaking to a live agent that will guide you with any questions that you have, in addition to the representation that you're going to get in Washington. They can take comfort in the knowledge that the representation, and I'm on that team, John. I was in Washington last week. We are proud to represent our members and their values, and their values are shared by the vast majority of people in this country, and they can take comfort in the knowledge that they are that they're joining a group of like-minded people, and that we do constitute the majority of thinking in this country, regardless of what's being portrayed on the news or what they're reading in any newspapers, if they're still reading newspapers.
I tell you what a spirited analysis of AMAC. People interested to get more information, go to amac.us. That's AMAC, AMAC, amac.us.